Greetings to co-email viewers. For this year's World Stroke Day, we spoke with the Chief of Neuro Interventional Unit of G. Kuppusamy Naidu Memorial Hospital, Dr.Rasmiranjan Padhi, about the role of an interventional radiologist and why it is very important that when a patient has an incidence of stroke, he must come to the hospital on time. Here is what he has shared with us in this video.
The World Stroke Organization has predicted 15 million people will have stroke. Each minute 2 million neurons die if you don't treat. The role of interventional radiologist is very vital in this stroke care. Smoking is a very important risk factor for stroke. Our hospital is one of the oldest hospitals in this part of the country. We started in the year of 1952. In fact, we are the first hospital in this part of country to start cath lab services for cardiology procedures. And in 2020, that is this year, February, we started our new Neuro Interventional Suite, that is state-of-art biplane cath lab that you can see. And this is specifically dedicated for neuro interventional procedure and to offer the fastest stroke treatment. So, if you see about stroke, 1 in 4 people in their lifetime will have a stroke. And the stroke is one of the leading cause of mortality and morbidity all over the world, not only in India, it's all over the world. It's a major health problem. And this year, the World Stroke Organization has predicted 15 million people will have stroke. Out of that, 5.5 million people may die. And if people survive stroke, then they face lot of difficulties like physical disability, communication difficulty, loss of a work, loss of income, and also loss of social network. So it creates a huge burden not only to the family but also to the society. So to prevent that mortality and to reduce the morbidity, at GKNM Hospital we have started the state-of-art biplane cath lab to provide the stroke treatment, that is the interventional treatment for stroke. The role of interventional radiology in stroke is that as an interventional radiologist, what we do, we retrieve the clot from brain vessels and reperfuse the ischemic tissue. That is the brain parenchyma, which is not supplied by blood because of block in the blood vessel. We go there and retrieve the clot. In layman term, I can say we re-establish the blood flow to the brain, and we do it very fast, because if you reperfuse the brain parenchyma fast, then the recovery will be good, because time is brain. As you know, each minute 2 million neurons die if you don't treat, and if you can treat the patient very fast, the recovery will be good and patient can become functionally independent. As we have a dedicated state-of-art biplane cath lab especially for stroke patients, so we do very fast mechanical thrombectomy, and our fastest time actually is 10 minutes from puncture to recanalization. So for a hospital to be stroke ready, so they should have this minimum facilities for 24/7. One is they should have a dedicated cath lab. Second, they should have full-time neurologist and neurosurgeons. Third, they should have neuro interventional radiologist, anesthesiologist, intensive care facility, and finally neuro rehabilitation. And at GKNM we have all the facilities, and we are providing this stroke services since last 5 years. And this year we have added to our armamentarium this biplane cath lab, which is helping us to reduce our time as well as to give better outcome to the patients. If you see stroke, there are two types of treatment. One is IV thrombolysis and another is mechanical thrombectomy. In mechanical thrombectomy, what we do, we go there and we retrieve the clot from the brain and we establish the flow in ischemic stroke. So if the time is brain, you know, time is brain, because if we delay, then the outcome becomes bad. As an interventional radiologist, it depends how fast we establish the flow to the brain. Suppose patient came to the hospital at 9 o'clock, and if you can establish the flow within 1 hour, then that will be the greatest achievement, and patient will do good and they will become functional independent. So the role of interventional radiologist is very vital in this stroke care, because they help in establishing flow in large vessel occlusions. On this World Stroke Day on October 29th, there is a theme this year, don't be the one, because active lifestyle, that is the most important thing they are pressing upon, because if you are active and if you control your sugar, you control your blood pressure, and you are doing exercises, and you are not smoking. Smoking is a very important risk factor for stroke. Then you can avoid getting a stroke in your lifetime. And 1 in 4 person can get stroke in their lifetime. So if you are active, you are watching your sugar, you are controlling your blood pressure, and you are treating your heart diseases, then you may not get a stroke. So I will stress upon to lead an active life. Stop smoking. If you are smoking from today, if you are watching me, you should stop smoking and have exercise daily and watch your diet. And this COVID pandemic also, you should know the signs and symptoms of stroke. You should be knowledgeable about stroke, so that if you are suspecting a stroke, you should come to the hospital immediately, because if you come to hospital immediately, if you get treatment immediately, then your recovery chance will be very, very good. And if you delay, then the recovery, even if we offer treatment, the recovery will not be that much good. So my message is, for COVID, you should stay indoors. If you don't have work, don't come outside. But if you are suspecting stroke, you should come immediately to the hospital. We are here to help you. Thank you so much.